Alright, hi everyone, this is Nick from medschoolmastery.com. I'm here to answer a few more questions. And one that I got when looking through the comments was about what you should do when you're new to this whole pre-med thing. You might be a freshman in college, you might be a senior in high school, or a sophomore or a junior in college, that's sort of deciding a little bit later on that you want to get into this. So I put down a few of my thoughts, as well as talking with some other people that had gone through this, to see what are the main steps that you should be doing. So it really is twofold. Your early college goals and your late high school goals, your early pre-med goals are to first of all master your own study techniques, and second of all find your passion. So on the first point, mastering your studying techniques, recognize that medicine is a difficult path that is very academic. So you need to do well in college, you need to do well on your exam, your MCAT, and then you need to do well in medical school, well on your board exams. It just keeps going on. And so if you are having a problem with focusing in your classes, if you're having a problem with just being in classes and you want to get out, you need to recognize that medicine has a lot of classes in it. So keep yourself, focused on your goals. And if you think that you can stick with the whole class thing, then you'll be able to be a more successful medical student. So it's important to master your test-taking skills. So if you can take any little mini courses on standardized tests, or if you can just sort of master your speed reading skills or anything like that, this will all help as you go through the process of being a pre-med and getting into medical school and being a successful doctor. So I'd additionally say that you should take the most difficult courses that you can handle. It's important to really build a strong foundation. So if you're in high school and you can take AP classes, take them. If you're in college and you can stretch up to a 4,000 level class, take it. So you need to make sure you get a good GPA, and that's important to consider as well. But more so, the point here is that you want to set a solid foundation for yourself, and then this will also allow you to kind of coast through medical school a lot more than your peers if you have a bit more of an advanced preparation in the sciences. So take the most difficult things that you can handle, and make sure that you can handle all these things without a high level of anxiety or stress. So the second part of this is finding your passion. So when you're finding your passion, remember that first of all, with medicine, you need to make sure that you're cut out for it. So what do I mean by that? I mean that it is a gory profession. There's blood, there's guts, there's death, and there's life. So if you can handle all of that, then you'll be much more fit for medicine. So I would say put yourself in clinical situations, get in the hospital, go abroad, get in the hospitals abroad, whatever you need to do to actually see medicine happen, to see things like childbirth that are just, bloody and kind of, nasty. If you can handle that, if you can handle surgery, that will show you that you, one, have an interest in the human body, but then also that you can handle, some of the nastiness involved in medicine. In addition, as you're going through all this shadowing, ask yourself, can I see myself doing this for the rest of my life? Can I see myself being in a hospital for the rest of my life? Can I see myself treating patients for the rest of my life? Medicine is really a calling. It's not really a strategical choice for, a great job. Don't look at it as a job, because I guarantee you that you can find many other things that are, one, much more time efficient, much more financially efficient, things that will earn you more money in general. So you can't be going into it for the money, you can't be going into it for the job. You need to feel the calling to be serving others using the sciences. So if that all sounds right for you, then keep pushing ahead. Make sure you're doing all the things you need to do as a young pre-med, and you can find some more of those tips about the things that you need to do as a pre-med, the required classes, choosing a proper major, preparing for the MCAT, all of that you can find at the medschoolmastery.com website, or you can take the pre-med bootcamp course, which walks you through all of things you need to do, as well as some of my best suggestions, as well as a few other medical students and doctors' suggestions of what are the highest yield things you can be doing inside and outside the classroom to be a competitive applicant. So you can check it all out at medschoolmastery.com. Please like, share, or comment on this video, and I'll look forward to seeing you at the website. Alright, thanks.